My daughter's name is Elokuhle and una 6 weeks old. Into engithanda ngayo ismile sakhe. Mhlambe ngifeel like ngathi uyangizwa nami nangikhuluma naye. Ngenkathi ngipreg first born yami bengina 22 years. Beku right by the time, but this one bengina 34 years. So kube difficult kulo than kulo ekuqaleni. Ukuthola kwami ukuthi ngipositive man during pregnant into bengithukela ukuthi ingandluleli umntanami. Azange ibe surprised, azange ibe shocked. Nedi nje kube like kwangathi nami this thing seyikhona kimi kusho ukuthi fanele ngimanage ngimonithe ngiphile healthy. Ngaregister kuMom Connector bengina 14 weeks pregnant and then ngaqala lapho ukuthola ama message. It was easy, just they take your phone bathatha phone bayenze via SMS or WhatsApp. Mom Connector ungincede kakhulu ukuthi kubalekile ukuthi nang positive umntwana ngimunyise noma ngabe akuphumi next ebeleni ibele lokucala libalekile emntwaneni, especially if uni positive ngoba liyamvikela ukuthi angangena ukugula. Uma ngithola ama message kuMom Connect ngizizwa ngibalekile, should banendaba nempilo yami bayakhona ukuthi bangifundise ngingakwazi about ukukhulisa umntwana. Ucela ukuthi ngiyafisa ukuthi ahlale negative and ngizozama ukumvikela ngaso sonke isikhathi ukuthi ahlale negative and adle healthy.
Okay, so on the stage, we have Garrison from the Good Corp, who will be our moderator. We also have Gustav from Praekelt over here, and we also have Colleen from Johnson & Johnson with BabyCenter, and they're going to talk about an amazing collaboration on maternal health.
Wonderful. So obviously, so I apologize, I have a hoarse voice, so this is sort of like back to the late night version of social innovation. So Colleen, that gave us a great introduction to Mom Connect, which we'll come back to. But can you kind of zoom out for us and talk about mobile technology for expectant and new mothers and BabyCenter and kind of the broader context for this work?
Yeah, absolutely. At BabyCenter, our vision is a world of healthy pregnancies, thriving children, and confident parents. So for us, a world, we're really serious about a world. And so we use technology to reach moms in developing countries mostly through desktop and the internet over the last 20 years. But as soon as we really started to see mobile technology coming into play, which 2008, 2009, and we were really seeing moms and new parents are early adopters of technology. We were doing a lot of analysis across the globe, seeing that 3G phones were starting to become massively available in the underserved communities, and really wanted to live in to our vision. Luckily, we're also owned by Johnson & Johnson, one of the biggest healthcare companies in the world, and also known as the Mom and Baby Company. And we really have an obligation and opportunity together to really reach all people with better health care. So that really got us moving along. And mobile phones were a way to deliver and reach more of these individuals as it continued to grow. So just looking at it as a delivery platform and understanding how to change the format of what we were doing. We actually created a program in India ourselves back in 2009. Successful for the consumer, but very expensive, not scalable, not sustainable, and really realized we couldn't go this alone. And that's when we got together and formed the Mobile Alliance for Maternal Action, which was MAMA. And we got partnerships. It was a public-private partnership. We worked with Johnson & Johnson, BabyCenter, and then USAID and the UN Foundation, and started to look for other partners more locally. And that's when we got hooked up with Praekelt, which was incredible, and other folks, as well as the governments, which are critical in actually making these projects work. We created 10 programs in 10 different countries. We've reached over 6 million new and expectant parents to date. And then we also, the second half of that was we created open source messages. So we created messages through the 9 months of pregnancy and 0 to 5 in English for any organization across the world to be able to subscribe to for free. We've covered 160 countries with 160 different applicants for 54 countries, reaching over 30 million moms and parents across the globe today. So having that access to that information. What we do well is create that information to be able to emotionally connect. And the impact that we've seen, you just saw some of it from the video, it just makes me always smile, but she reiterated a lot of things that we really teach her as far as really exclusive breastfeeding, hospital delivery. When you go to a hospital to deliver your baby, you're much more likely to live if you have any complication that needs a C-section or preeclampsia, anything like that. So really increasing those odds. And the thing that we have seen, which also is all about mental health and everything, you saw the joy, you saw her say, they must care about me. That non-judgmental, when a woman gets HIV in Africa, in India, or other sorts of complications, they're really shunned. And having just that voice, that even that text message to really get that caring across is something that is just invaluable and really allows these women and parents to be able to feel confident and comfortable and joyful in raising their kids for the long haul.
Awesome. So that's a terrific bird's eye view. And then Gustav, like zeroing in on Moms Connect, what's so particularly kind of innovative and exciting about the work that you all are doing in South Africa?
Yeah, and as you can probably hear from my accent, I'm far away from home. I'm from South Africa and very jet lagged. But I haven't seen that video before, and I kind of teared up a little bit. I think the really amazing thing about Mom Connect, there are a lot of programs globally sending messages, and I think a lot of people in this room also believe that providing information at the right time can change behavior and improve lives. But I think the really incredible thing here was that the three things that made this work really well in South Africa. We started with incredible messaging and great partners like BabyCenter and incredible knowledge of maternal health. But then the key thing was that we had deep integration. We had a Minister of Health, Aaron Motsoaledi, he's a medical doctor. He took the lead and said, I want to have this and I want to have universally rolled out in South Africa. And that deep integration made it possible that we could actually have a national program. So even though it was funded by USAID and Johnson & Johnson and international philanthropy, we had a national program in South Africa. It was universally available. The minister said it has to be available for every mother, which meant it had to be free, which meant we had to make everything zero-rated. It had to be available on any phone. So anybody ever used something called USSD? So really low-end technology that works on every device, works on SMS, and of course it had to be available in 11 languages. And I love the fact that the video was in South African vernacular and not in English, because that really made it localized and accessible to everybody. And then the final thing, the third thing really was the fact that was almost an aside, it wasn't really planned from the beginning, was this idea of a feedback loop. So asking mothers, as we rolled out the service, how to improve the service. And so any mother can send an SMS for free, and we have a call center that supports them, not via voice, just text. And we've now answered over 1 million questions over the last couple of years. And I think that feedback loop really made this much more an agile project where we could actually change the project over time. So over the 4 years, chipping away at the things that made it hard to understand, we found out all sorts of incredible things like, for instance, there are stockouts in clinics. We know which clinics are performing poorly because the mothers don't like the service there. And it also made us more, I think, flexible to roll out new technology. So I don't know if you guys saw, there was a little notice of WhatsApp. For people outside of the, inside the US, you might not use it so much, but everybody else uses it in South Africa and Africa. And so what that really allowed us to do is integrate on a much deeper level. Video, audio, having conversations with mothers. So 90% of our traffic to the help desk now is actually over WhatsApp. And so I think that points in the direction of a lot of universal healthcare services that we can actually do and provide in low income settings.
And you're the only current social impact program using WhatsApp.
At scale,
right.
Yeah.
And you have an announcement to share with us too of a new milestone.
Yeah, so we tweeted about this, so it very luckily and coordinated in such a way that this week we reached 2 million mothers in South Africa, which is, and that's really a credit to the South African government, really, who led this, and all the partners that stuck with the program. Overnight success takes 8 years. So it was a long time getting to that point. But 2 million mothers, by the way, that's 80% of all the mothers in South Africa. We have 1 million births per year. We're in all the clinics now in South Africa, 4,500. So that's just a real testament to the incredible team that works so hard to make this happen.
That's awesome. And we were talking earlier, you guys have learned so much. I think you were saying that, 8 years, it takes 8 years for an overnight success. There's a lot of challenges along the way. It's not all successes. What are some of the bumps you've hit, the lessons you've learned that might be applicable even for folks who don't do mobile messaging for maternal and child health?
Well, I would say Gustav hit on one. I mean, having local government involved initially is huge, and being supportive, or at least the hospital systems in a locale, to be able to get that distribution, the connectivity within with the society and with them. The other thing I think, and selfishly I will say this, but I think it makes a huge difference, is really having content that is written correctly, or video that really tells the story and is able to emotionally connect with a person, respect her, not judge her, and give her both education and delight. That is how the BabyCenter model and methodology works, and we've just shrunk that down into 120 characters or less, but really making sure that you give her all of that. So being able to say something like, your baby can hear today because they've developed hearing. Sing to them. They will recognize your voice. And also make sure to take your HIV medication and be the best mother you can be. Really giving them advice, support, and then really bringing it home so you do invoke behavior change. The messages really do matter. That is important. You can't go it alone. You must have great partners, and you must respect your partners, listen, be open to hear. Gustav was just telling me earlier, I mean, you just had the big government meeting, and one of my cohorts from J&J was there, a lot of Gustav's team was there, but really continuing to have that, you sit at the table with all your partners and move that forward. And then hearing your consumer, getting the feedback, setting up evidence-based KPIs in the very beginning so that you're collecting that. And don't be extreme in the outcomes you're trying to do. Little steps are great.
And looking at the data. I mean,
yes.
It's embarrassingly, we couldn't understand. We launched this WhatsApp thing a couple of months ago, and we were like, of course, everybody's going to use WhatsApp because it's so awesome, and it's cheap, and it's free, and all that. And we couldn't understand why our opt-in rates were so low until we found out that, as nurses do, they solve problems. And we looked at the data, and we could see all our registrations were happening at 6 o'clock and 7 o'clock in the evening, and that didn't make any sense to us. Like, why would that be happening? And so what was happening is in our most busy clinics, the nurses obviously figured out that it's a really bad idea to try and opt somebody in as they come along. So they had forms and they were signing people up, except the form didn't have a WhatsApp box in it. So you couldn't opt people into WhatsApp. Even if you asked the mother, they would, and so this is one of those things that you just don't realize why things are going wrong until you actually look at the data. Obviously, the amazing thing though is that we have 2 million mothers now, and we're speaking to them on literally on a daily basis. So you have this incredible amount of data now that we can throw at machine learning algorithms. We could look at for instance, sentiment. We can say that people are unhappy just based on the language they use and the words they use. And we can use that to go and look at the clinics that are performing poorly. So yeah, always look at the data and always look at the patient.
Awesome. And then just in the last few minutes, here we are in Silicon Valley thinking about driverless cars and other futuristic concepts. When you look out 5, 10, 20 years, what's the future for this tool, for this technology, for this approach to helping mothers and children?
Well, I mean, mobile technology is going to continue to evolve, and smartphones are going to become more ubiquitous. So this is going to continue to definitely evolve. At Johnson & Johnson, you know, the vision is to improve the trajectory of health for humanity. So I think continuing to focus on mom and the first 1,000 days of a person's life is the only way you're going to really affect that trajectory. And so I think continuing with technology and utilizing the best that technology has, but focusing on this maternal health area to really get health for humanity really going in the right direction is hugely important.
Awesome. And for Moms Connect?
Yeah, I'm just, you know, I'm old enough to remember, you know, I'm from South Africa and we overcame, you know, I grew up in apartheid actually, and I was there 24 years ago in the crowd when Nelson Mandela was inaugurated, and that was I mean, we already overcame so much. This took now 10 years to get this up and running, but we're basically registering every single mother in South Africa. And so we started discussing this talk that Colleen was talking about to government about, I think within the next couple of years, I think 5 to 10 years, we'll be in a situation where every single patient that seeks care in South Africa will be able to register for a free service that'll be personalized, that'll give that person individual care at any time, both before they come to the clinic and after they've been to the clinic for treatment. And I think that's completely possible. Looking at the fact now, I had hoped, but I certainly didn't think that we're going to reach this level of success in a number of years. And then a little bit further out, 20 years, 30 years from now, I think that's completely possible that we could do this globally. I really think...
Can we do it here?
Yeah.
I don't know, I think the US is it's a little bit hard here.
We do a little bit here already.
But certainly, I think that's an amazing thing. You know, South Africa is an incredible place in terms of the diversity we have, huge challenges, huge opportunities, and I think we have opportunity to leapfrog and build systems from the ground up that really empower universally every single person. And I think in our lifetimes we will see that we'll have universal health care for every single person living in developing and low middle income countries. So.
Wonderful.
We've got, I mean, the Moms Connect program is by far and away, I think, the most advanced, but we do have the Amitra program in India growing rapidly. We're already over 2 million people there. Government there is a little more difficult as far as just there's many of them by state. It's a huge country. But we are seeing a lot of improvement there, and we're using a lot of voice technology there. So families, we're hitting communities even over one phone. So that's also great. And who knows what technology will continue to develop to make it easier. But we operate agilely, so continuing just like a startup would, and test, learning, and iterating, and continuing to move forward as all of this comes out and is new.
And I think Bill Gates has said we overestimate the impact of technology in the short run, and we underestimate it in the long run. When we started with this, everyone was saying, well, all you're doing is sending messages, and you know, it's Africa, people don't have phones. It's 2018, you know that we have 100% penetration of mobile phones,
Absolutely.
of mothers coming to clinics in South Africa, and we have 60% of mothers now have smartphones. So really in another couple of years, it'll be completely possible to deliver personalized care to every single person. And if we can, we should. That's really what I hope this will see in the next couple of years.
Awesome.
Absolutely.
Well, thank you both so much for sharing that with us.